Good evening, everyone. There are new warnings tonight about the rapid spread of a virus in Africa. The World Health Organization now says could spill across international borders. A previous public health emergency 2 years ago was caused by a milder strain of the mpox, or monkeypox virus. But a mutation last September has created a new variant scientists say is far more deadly. The WHO says there have been more than 14,000 cases and 524 deaths in Africa this year, already exceeding last year's figures. CTV's Heather Wright on who's most at risk, the symptoms, and the Canadian impact.
Mpox cases in Africa have surged 160% this year, a spike that has prompted the World Health Organization to declare a global health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Officials say a new variant of the virus appears to spread more easily than the one that prompted a similar warning from the WHO in 2022. What started as an outbreak in the Democratic Republic of Congo has now spread to more than a dozen neighboring countries. In Canada, Mpox cases have also increased, though to a much smaller degree. Toronto Public Health says as of July 31st, there have been 93 reported cases, up from 21 this time last year.
In 2022, the epicenter was largely in Montreal. Now it seems to be in Toronto.
The virus is transmitted through close physical contact, causing flu-like symptoms and pus-filled lesions on the body. Cases are uncomfortable but often mild, though more than 500 deaths have been reported this year in Africa. Experts say those most at risk here in Canada are men who have sex with other men and sex workers.
I think that has led to the misconception by some people that it's a sexually transmitted infection, which is not true. It does appear to spread regardless of the contact. It's just that by chance, to a certain degree, it seems to have embedded itself within this community.
Members of that community are encouraged to get vaccinated, while experts also urge governments around the world, including Canada, to share its vaccines.
I know there's logistical hurdles and regulatory hurdles, but it's been 2 years, and there's still very limited access to these products in areas that are hardest hit.
Health Canada says it has a sufficient supply of mpox vaccines, and a potential donation is one thing the government is considering, though they add at this point no formal request has been made. Heather Wright, CTV News, Toronto.